To begin, fill the water seal with sterile water or sterile saline via the pre-attached, pre-measured funnel by holding the funnel downward and filling it to the top as shown. By raising the funnel, water will quickly empty into the drain and fill the water seal to the required 2 cm level, indicated by the dotted fill-to line. Remove the funnel and discard after use. Next, connect the chest drain to the patient by inserting the patient tube connector directly into the thoracic catheter. The patient is now on gravity drainage or 2-water seal. To apply suction when prescribed by a physician, the suction control chamber can be filled to the desired pressure level simply by removing the tethered vent plug, pouring water to the desired suction control pressure level, and replacing the vent plug. As with any chest drainage system, the drain must be placed below and kept below the level of the patient's chest and kept in an upright position to maximize drainage efficiency. We recommend hanging the unit bedside. When you are ready to initiate suction, connect the suction source to the chest drain suction port or suction control stopcock and slowly increase suction at the suction source until constant, gentle bubbling occurs in the suction control chamber. Available on most Ocean models is a suction control stopcock, which provides simple control of vacuum to the drain for efficient system operation with less bubbling noise and less evaporation. When applying suction from either a wall regulator or pump, leave the stopcock in the on position and slowly increase the suction source until constant gentle bubbling occurs in the suction control chamber. The suction control stopcock can be adjusted as necessary to increase or decrease suction control bubbling. When applying wall suction without a wall regulator, simply turn the stopcock to the off position prior to connecting to the suction source. Use the suction control stopcock to slowly increase suction until you obtain a constant level of gentle bubbling in the suction control chamber. All patient tubes and suction connections should be routinely checked to ensure proper leak-proof operation and chest tube patency. Like all Ocean models, the Ocean 2002 single drain collection chamber incorporates a large writing surface with big, bold numbers and easy-to-read fluid level graduations. On selected models, samples can be taken directly from the Luer-Lok sampling port, located on the patient tube connector. A water seal is a simple one-way valve, which allows air to exit the chest and prevents air from returning to the patient under normal conditions. Continuous bubbling observed in the water seal will confirm a persistent air leak in either the patient's thoracic cavity or possible tube connections. Intermittent bubbling with gentle float ball oscillation will confirm the presence of an intermittent air leak. And no bubbling with minimal float ball oscillation at the bottom of the water seal indicates that no air leak is present. Bubbling from right to left in the air leak monitor must be present to confirm an active air leak. The Ocean Graduated Air Leak Monitor allows visual detection of air leaks from a low volume of 1 to a larger air leak volume of 5. Air bubbles passing through the graduated air leak monitor help the clinician assess air leak patterns and patient air leak trends. Changes in intrathoracic pressure can be determined by observing the level of the blue tint water and float ball in the graduated water seal column. Getinge's blue tint water and float ball make changes in patient pressure easy to monitor. When the system is connected to suction, patient intrathoracic pressure will equal the suction control setting plus the float ball water column level. For gravity drainage applications, patient pressure will equal the float ball water column level only. Each Ocean chest drain incorporates a high negativity float valve, which is located at the top of the water seal chamber. During normal or deep inspiration, the float valve will allow thoracic patients to draw as much intrathoracic pressure as they may require during each respiratory cycle. However, during prolonged periods of accumulating vacuum pressure, Getinge's float valve will automatically lower high vacuum pressure down to a lower level. The unique controlled release valve design protects your patients against prolonged exposure to excessive negative pressures, which can accumulate as a result of repeated patient tube milking or stripping. To manually lower the height of the water seal column when connected to suction, temporarily depress the manual vent located on the top of the drain until the blue water column lowers to the desired level. It is not recommended to depress the manual vent when suction is not connected or not operating. When monitoring a patient's chest drainage system, it is important to periodically check the water seal's operation and fluid level. If the water seal is either underfilled or overfilled, it should be adjusted accordingly to the prescribed maximum 2 cm level. Using a 20 gauge or smaller needle with syringe, adjust the water level via the grommet located on the back of the water seal chamber. The volume and height of water in the suction control chamber is what safely controls the amount of suction pressure provided to the patient. The Ocean traditional wet suction control format is a simple but reliable method for regulating vacuum to patient. When monitoring a chest drainage system, it's important to maintain constant, gentle suction control bubbling. If you need to increase or decrease the amount of suction to a patient, simply turn off the suction source and adjust the height of the suction control water level accordingly. By either adding water or removing water using a 20 gauge or smaller needle with syringe, and adjusting via the grommet located on the back of the suction control chamber. In the event of an accidental knockover, place the drain in an upright position immediately and check for interchamber spillover and correct fluid levels. Both suction control and water seal fluid levels may be adjusted as necessary. For models equipped with a suction control stopcock, it is recommended to leave the stopcock in the on or open position at all times, even when the suction line is not connected or in use. As a safeguard against tension pneumothorax, a fully automatic positive pressure release valve opens to release accumulating positive pressure. When such clinical conditions may arise, its tamper-resistant design is located on top of the drain. Select Ocean models come equipped with a locking inline connector and patient tube clamp that provides convenient, simple disconnection after use, or rapid inline ATS blood bag attachment when required. The patient tube slide clamp must remain open at all times during system operation.